Endometriosis is a very invalidating disease characterized by a progressive inflammation of the affected tissues. But this inflammation at the beginning is limited to the ovary, to the uterus when we have adenomyosis or other affected organs. But when this inflammation persists in the pelvis, over time it will become systemic. Say, the inflammatory molecules produced by our soldiers, the mast cells, will float into the blood, go to the brain, and cause neuroinflammation. And this is the leading etiology of depression that so many women complain of when having endometriosis. But also, this systemic inflammation is responsible for another critical symptom, fatigue. This sense of being always tired, this sense of having no energy. Inflammation is the killer of our energy, and so reducing inflammation in the pelvis, in the blood, in the brain is the critical goal to empower women to get back their energy again. So, endometriosis and the sexual symptoms are just the tip of the iceberg of a more threatening situation, say, inflammation, pain, depression, infertility, with an impending risk of premature menopause, because we know that when we take away a piece of ovary or a full ovary because of an ovarian endometriosis, we diminish by 50% the ovarian follicles. But if we have more treatment, over time we will cause a iatrogenic menopause, say a menopause due to medical treatment that have progressively reduced the ovarian follicles. And this means reduced fertility or frank infertility and an early menopause with all the symptoms it conveys. But this means also a couple crisis, particularly when the woman is very young. She cannot have babies, and this is a major threat also to the survival of the couple itself when the husband cannot think to stay without children. So really, really a challenging disease that affects the whole woman's sexuality and the relationship. When we consider women's sexuality, we have three major dimensions: sexual identity, sexual function, and sexual relationship. The identity is the sense of being a woman, the happiness of being a woman, and the pleasure of considering femininity in all the expression: the elegance, the sensuality, the maternity, the satisfaction of realizing herself in a job, in a work that expresses her talent. Sexual function means certainly have desire, central arousal, feeling all the body desiring, wishing to have intimacy, feeling a good physical response, having intercourse with joy, up possibly to orgasm, and then this wonderful relief when we are so satisfied, so full of happiness and sweetness that we really sleep like angel because all our body and our brain are super relaxed and satisfied. This is a happy sexual function that, as I said, is threatened by endometriosis. But the third dimension of sexuality that is affected is the relationship. So, sexual identity, function, and relationship. But my other point is that we make love with someone, and this someone is critical for the story. So, when we talk about endometriosis and sexuality, we are not simply talking about women identity, function, and relationship, but we are also talking about man sexuality, the partner sexuality, his identity, his sexual function, his relationship. So it's very important to keep a balanced perception, because very often I talk with the couple And this conversation is extremely important to help them to talk to each other in a different way, to explain to the partner why she has such a devastating pain, and very important to me, how we can help her to reduce pain and how he can help in the healing process. This is very, very important because the couple will find a different way for their dialogue, for their intimacy, but also to design a future together, because otherwise endometriosis may really disrupt the couple and their future. Now, what are the factors affecting sexuality when endometriosis is involved? We have three major group of factors: endometriosis related, woman related, and context dependent. Certainly, if we consider 100 women with endometriosis, we have very different clinical pictures also from the sexual point of view. Why that? Because we have differences in onset of the disease, age when it was correctly diagnosed, time interval between onset of symptoms and correct diagnosis. We know from recent survey that 1 year is the time lag usually needed from having the first painful period or deep pain during intercourse or other symptoms and the first medical consultation. Unfortunately, on average, women need 6 consultations and 6-7 years to have a perfect, correct diagnosis of endometriosis. All this time lead the disease to progress and cause other symptoms. Intensity of pain and intensity of inflammation is another variable very critical to predict how deeply endometriosis will affect sexuality. Stages and recurrences, and obviously number of surgical interventions and a type of treatment, medical versus surgical. The second group of variables is related to the patient: personality, education, access to qualified medical treatment, but also the preoperative sexual well-being, because clearly the situation is different, and also the relational situation. And third, but very important, the quality of the support in the family, but particularly from the caregivers. So, in every woman, we will consider factors endometriosis related, woman related, and context related. This said, we will see in a moment how endometriosis may affect sexual identity.